like many people, Paola's story started with back pain, pretty common, but it got worse and worse, and then she had so many surgeries. Finally, one day she said, no puedo más. In other words, I can't anymore. That's when she went to go see spine expert Dr. Gosha Brusovanik. Hear this amazing story.
It got a point that when I went to see Dr. Brusovanik, I was about to give up. I was about to say, you know what, whatever happened, happens.
And we talk about that, doctor, and I want to bring you in about, no puedo más, I'm going to give up. Yeah. And when you came in and you saw her situation, what did you do? Because this is complex. No. She went through a lot.
Yeah, she went through a lot. Look, Paola is a unique individual. She's a really strong person. A lot of people would have succumbed. When you have this many operations, and you're not getting better, I mean, think about it. It's just, I can see how tough that was.
Oh my goodness. So you decided to do a disc replacement on her?
Look, on my end, the job is pretty simple. It's straightforward.
He says that so humbly, doesn't he? The job is really simple, and it's not, but he's just so good at what he does. Go ahead.
What I did was, I listened to her, and I figured out which nerve was involved. She had pain going down the arm, and we figured out which nerve was hurting, and it was clearly coming from the level right below the fusion, which is what 25% of patients get every 10 years after their fusion. So this is not rocket science. You find the nerve that hurts, you send the patient for an injection, and they get better. So you confirm that indeed it's that level. Now, a lot of those patients after the injection just get better, but Paola didn't. She had an objective problem. She had hypermobility next to a fusion, which is what young people get. So then I snuck in, replaced that disc, and she was better.
And how do you take the disc? I mean, you make it sound so easy, doctor, and I appreciate that, but how do you take that disc out? Because I'm sure when you heard about what he was going to do, didn't you kind of go like,
No, because I already went through the lumbar surgery with him, so I knew that I was in the best hands ever.
Oh, that's also great.
I was like, whatever he will have to do, he was going to do it fine.
So in layman terms, doctor, and I know it's a procedure that it's very intricate, but how did you take the disc out? Can you explain that to us? Paint a picture, if you will.
The thing is this, most likely your viewers right now are having breakfast. And if I really paint you a true picture of what I'm doing, you're going to lose some viewers.
I love it. Okay, so let's...
Objectively...
Let's keep it simple.
Right, there's no magic to it. You remove the disc in its entirety and you just make that space look perfect. You remove the compression from the nerve, you remove the compression from the spinal cord, and then you have a space there, right? Maybe clean and beautiful, but you can't leave empty space. So the classic thing is you put a big piece of plastic, put screws and immobilize it. The new thing to do is you size the space and you fit a perfect prosthesis. You make sure it moves perfectly, you make sure that there's no bleeding, and then you do a plastic surgery closure on the neck so that the patient doesn't walk around with a big gash. That's it.
And I want to add, this is minimally invasive, right?
It is. So the trick is, as opposed to the classic thing where you just sort of cut till you get to the spinal cord, here I use a variant of essentially surgical Q-tips. But if you go just a little slower, you can get to the same place without cutting anything. So look, I'm not unique to this technique. I think you'll see a lot of younger surgeons coming out of training doing things the same way.
All right, I know we have some pictures of you before and after. How did you feel after the surgery? Was the relief there?
Right away.
Oh, who is that?
That's my brother.
Oh, he's handsome, young man.
Yeah, he comes, he's almost through, he has been through all my surgeries.
And look at the thumbs up.
This was like I think this was the second that we did. Yeah. I walked out of the hospital the day after.
And you felt better? How was your recovery?
Immediately. Like this.
Like that?
Like that.
Oh my goodness. Yeah. I think we are going to show the phone number real quick in case you have a question for Paola or the doctor. Let's show that to our viewers. And that's 855-796-4475 if you have a question for Paola, any concerns you may have, or the doctor. All right, so we have a great story here of Paola, because we're going to stick to our superstar right now. She had multiple surgeries with Dr. Brusovanik, and we have a video of hers a month after her surgery. Take a look at this.
Good morning.
Good morning. How you doing?
How are you feeling?
Awesome.
How are you doing today?
Oh my God.
Oh my God.
Better impossible.
You look amazing.
Thank you so
You're
much.
here today for your follow-up with Dr. Brusovanik.
Absolutely. It is not even a month of my surgery.
Oh my God. So
Yeah.
how many days today?
It will be, if on Friday will be a month. Well, a month from the first surgery. Remember, there were 3 surgeries, okay?
Oh, I see.
But I'm doing great. Well,
You still remember how was the pain before the surgery?
oh my God, it was, intolerable. En la pierna prácticamente ya no la sentía. No tenía vida. tenía 5 años así. Punta de narcóticos, o sea, no tenía vida social. It was a mess. And thank you, Dr. Brusovanik.
How are you feeling today? See you.
You see it? Creo que no hacen falta palabras. Gracias. Dr. Brusovanik, you're a miracle worker.
Thank you.
No podía pedir más nada en la vida que tener a un doctor y a un equipo como ustedes. Obviamente,
Gracias.
este tatuaje fue dedicado a ustedes.
Gracias.
Se quiere decir, tengan fe, los milagros suceden. Y bueno, aquí tengo la prueba. Gracias a ustedes.
Oh my gosh, I am so emotional. Dr. Brusovanik, you're a miracle worker. That's amazing to hear. Doesn't that just fill your heart?
I mean, that's why I get up in the morning really, really early.
And the tattoo she had, by the way, she just showed it to me. Let me see it real quick. She did this right after her surgery for his office, and it says, "Have faith, miracles are real."
It was dedicated to Dr. Brusovanik and the team, of course.
Thank you.
Yeah.
This recovery, is it you know, what you see from most patients?
That's what I expect, yeah.
Like, she's not a miracle. This is something that you expect from the patients.
Yes.
Look at you smiling.
Thank you so much.
I do just want to remind our viewers, like with any surgery, we do have to let you know that there are risks. That's why you want to be in the best of hands right here. But let's show you those risks real quick. And this is for any surgery for that matter. You know, reaction to anesthesia, bleeding, infection, and nerve injury. Paola, you know, did you expect this kind of result? I mean, did you really think that you'd be that hyper happy woohoo girl again on the motorcycle?
Well, after
You were on a motorcycle, right?
Absolutely.
Okay,
Yes,
I just wanted to make
did.
sure you got those leather pants on.
Yeah, that is my passion. Like, let me tell you, after the lumbar surgery that I did with Dr. Brusovanik in 2017 and the results that I got, I knew that this was a piece of cake for him. So, you know, like, we did great.
Any advice for anyone, look at these pictures, how beautiful, out there who could be suffering right now? Paola has thought about, you know, doing surgery, not sure. What would be your words of advice? What a beautiful picture, look at that.
Well, the advice I can give to people is never give up, okay? You know, you always will find an angel, a miracle worker like Dr. Brusovanik, that it really will take serious your life and it will bring back hope to your life.
Life is good?
Absolutely.
How happy are we on a scale of 1 to 10?
Right now, I'm 100.
And before we leave, because I know we're a little bit over, I do want to share
Thank you so
also
much.
with our viewers the great work she's doing now because of everything she's experienced. Can I see that bracelet you have on?
Absolutely, yes.
She has a beautiful bracelet on. It's yellow, and it's for the children of St. Jude. And tell me what you're doing for them.
Well, like, Best Buy does like a donation every year in all United States, and for 2 years in a row, I have been the highest donator for St. Jude. And I have been imposed the golden pin and the platinum pin because of this. So after my cancer surgery, I'm dedicated to help the St. Jude, the hospital with the kids with cancer, so they can have to find a cure for them.
Absolutely.
Less kids have to die.
Absolutely.
That's how it is.
God bless you. What a pleasure
Thank
to have
you.
you. Thank you so much.
Thank
God bless
you so much.
Do you have a motorcycle? Like, do you own one?
Yes, I do.
Do you have a Harley?
No, I have a Yamaha
A
speed
Yamaha.
bike.
What color is it?
It's a black one.
A black one. Can I go for a ride?
Absolutely.
I've never been on a motorcycle.
Are you serious?
Yeah.
Whenever you want.
Okay, but can I be in the front, like driving?
Well, if you know how to drive, I will give it to you.
I've always done the vroom, vroom, and I've never been on one.
Oh, God.
All right, so that's a date.
Thank
I
you
love
so
it.
much.
You're a miracle worker.
Yes,
You've
yes.
got so many titles. Oh,
Thank you, Doc.
Thank you, Paola.
isn't this a great show? I mean, I don't want to be biased, but isn't this a great show? It's a great show.